So what is a hernia? A hernia is a bulge in the abdominal or pelvic wall, and it probably is something you probably are born with a weakness from that, but a hernia is truly when the lining of the abdomen has the ability to stretch out and come outside the abdominal wall. That's the definition of a hernia. Much more common in males than women. Women can get it. They can get what's called a femoral hernia, which is a little bit different location, but just by male anatomy, they're a little more vulnerable to a hernia. So it's a bulging outpouching in the abdominal wall or in the groin or scrotum that can cause some symptoms, can cause some discomfort. Does that mean that every hernia needs to be repaired? It turns out, for the longest time we thought that was the case, but it turns out it depends on the age you are when you develop the hernia. If you're a younger person, say perhaps in their teens, 20s, 30s, that means you're looking at probably 60 or 70 years that you would have this hernia. That probably warrants repairing. If you're someone 70 or 80 years of age that finally develops a hernia, and you're not going to be doing a lot of heavy lifting or a lot of exerting yourself, then you may not really need to have it repaired. One exception to that rule will be if you're having a lot of symptoms or if it's causing you some discomfort or it's preventing you doing something that you want to do. So how would you minimize the risk for it? One thing you don't want to do is to hold your breath if you're exerting yourself or straining or lifting something heavy. You want to always just continue breathing normally when you're doing something like that. So a new bulge in the area could be a problem, could lead to actually being a hernia. And there's sometimes, even if you have a hernia, what is the time that you actually need to go get it repaired? If the symptoms, if you have some soreness or tenderness around the bulge and it responds to over-the-counter anti-inflammatories, naproxen or ibuprofen or something like that, then it's probably something you can watch for a while. The only urgent time to get a hernia repaired is if you have this bulging in the wall and a part of your bowel gets caught down there. That becomes an urgent and or could be an emergent situation. How will you know that happened? You'll be very sick. You'll have fever probably, you'll be nausea, it's blocking your bowel, so you may actually have some vomiting. So that's the time you actually need to go to the emergency room if you have a new bulge and suddenly get nauseated with vomiting, then you need to go to the emergency room for management of that. But otherwise, you probably have some time. The good news now is technology has also really improved the technique for treating the hernias. And you sometimes can be done with local anesthetic, or they have laparoscopic repair of it, where they actually go through with a scope from the belly button and put a patch over it from the inside, which really seems to minimize the symptoms and or the scar tissue afterwards. So that's what we do with hernia these days.